Hey guys, it's Health Inclined TV again and welcome back to my channel. Today, we're diving deep into a topic that's incredibly important for everyone to understand: strokes. Strokes are often called silent killers because they can strike suddenly and without much warning. In this video, I'll break down the signs and symptoms of a stroke, what to do if you or someone around you experiences them, and most importantly, how to prevent this from happening in the first place. Firstly, let me explain what a stroke is. One of the most significant risk factors for a stroke is persistently elevated blood pressure, also known as chronic hypertension. Blood pressure is the force of blood pushing against the walls of your arteries. When you have a constant traffic jam, that's high blood pressure. Over time, this constant pressure can damage the walls of your blood vessels. When the blood vessels in your brain are damaged by high blood pressure, they're more likely to become blocked or burst, interrupting the vital blood flow that your brain needs to function correctly. Many people don't realize they have high blood pressure because it often doesn't have any noticeable symptoms. With lifestyle changes like diet and exercise, and in some cases medication, you can get your blood pressure under control and significantly reduce your risk of stroke. Monitoring your blood pressure regularly is crucial, especially if you have a family history of hypertension or other risk factors. We all experience fatigue from time to time, especially after a long day or a poor night's sleep. But did you know that excessive fatigue, that feeling of extreme tiredness that just doesn't seem to go away, can actually be a warning sign of an impending stroke? If you're experiencing intense, persistent tiredness that's unusual for you, and it's not related to any obvious triggers like physical exertion or lack of sleep, it's crucial to pay attention. This kind of fatigue can be your body's way of signaling that something is wrong, and it could be a sign of a potential stroke. When the blood flow to your brain is compromised, even temporarily, it can disrupt the brain's normal functions, including its energy regulation. So if you're experiencing unexplained, persistent fatigue, especially if it's accompanied by other unusual symptoms, don't ignore it. Talk to your doctor. Early detection is crucial when it comes to stroke. Our eyes are incredible organs, providing us with the gift of sight. But they also serve as windows into our overall health, often revealing underlying issues that might otherwise go unnoticed. Sudden changes in vision can be a red flag, a warning sign from your body that something is amiss with your brain's blood supply. These changes can manifest in various ways, from blurry vision and double vision to difficulty focusing and even temporary loss of sight in one or both eyes. If you experience any sudden changes in vision, especially if accompanied by other symptoms like dizziness, weakness, or difficulty speaking, it's crucial to seek medical attention immediately. Don't wait to see if it goes away on its own. Remember, time is of the essence when it comes to strokes. Early intervention can significantly improve outcomes and reduce the risk of long-term damage. Headaches are a common ailment, often attributed to stress, lack of sleep, or even caffeine withdrawal. But what happens when a headache strikes suddenly, seemingly out of nowhere and with an intensity you've never experienced before? This could be a warning sign of something far more serious, a stroke. Imagine this: you're going about your day, feeling perfectly fine, and then bam! A searing pain erupts in your head like a bolt of lightning. This kind of headache, often described as the worst headache of my life, can be a sign of a ruptured blood vessel in the brain, also known as a hemorrhagic stroke. If you experience a headache that comes on suddenly, is unusually severe, and is different from any headache you've had before, especially if it's accompanied by other symptoms like nausea, vomiting, stiff neck, or changes in vision, it's crucial to seek immediate medical attention. Don't hesitate. Time is brain when it comes to stroke. Up next, we'll explore another physical symptom that could indicate your brain is in distress. Our bodies have an incredible way of communicating with us, sending signals when something isn't quite right. One of the most alarming signals, especially when it comes to potential strokes, is sudden numbness or weakness in the body, particularly on one side. Imagine this: you're reaching for your coffee cup, and you realize your arm feels heavy, like it's filled with lead, or you're walking and your leg suddenly gives way beneath you. This sudden onset of weakness or numbness, especially if it affects one side of the body, is a classic stroke symptom and should never be ignored. If you experience any sudden numbness or weakness, even if it's fleeting, don't wait to see if it gets worse. Call for help immediately. Early recognition and treatment are crucial when it comes to strokes. Communication is at the heart of our human experience, allowing us to connect, share ideas, and express ourselves. So when our ability to communicate is suddenly disrupted, it's not only frustrating but also deeply concerning, especially when it could signal a stroke. Imagine this. You're chatting with a friend and suddenly you find yourself struggling to get the words out. Your speech is slurred, your words are jumbled, and you can't seem to form a coherent sentence. This sudden onset of speech difficulty, known as aphasia, is a major red flag for a stroke. If you notice someone suddenly struggling to speak clearly, or if their words are coming out garbled and nonsensical, don't brush it off as fatigue or confusion. It could be a sign that their brain is in distress and needs immediate medical attention. The faster a stroke is recognized and treated, the better the chances of minimizing brain damage and preserving speech and language function. Our senses are our connection to the world around us, painting a vivid tapestry of sights, sounds, smells, tastes, and textures. But what happens when our senses deceive us, when our brain conjures up experiences that aren't actually real? While hallucinations are often associated with mental health conditions, they can also be a sign of something more sinister brewing, a stroke. Imagine this. You're sitting in your living room, and suddenly you see a shadowy figure lurking in the corner of your eye. Or you hear a voice whispering your name, but when you turn around, there's no one there. When it comes to strokes, hallucinations can occur when the blood flow to the areas of the brain responsible for processing sensory information is disrupted. If you or someone you know experiences sudden hallucinations, especially if they're accompanied by other unusual symptoms, it's crucial to seek medical attention immediately. While hallucinations alone don't necessarily indicate a stroke, they warrant investigation to rule out any underlying medical conditions. Our brains are complex and delicate organs, and any sudden changes in sensory perception should never be ignored. Our brain, the command center of our body, orchestrates everything we do, from our thoughts and emotions to our movements and senses. So when the brain's intricate workings are disrupted, the consequences can be far-reaching and debilitating. This is especially true in the case of strokes, where neurological problems can manifest in a myriad of ways. Imagine this. You're trying to remember a simple fact, like your phone number, and it eludes you. Or you're walking and you feel unsteady, like you're on a boat rocking back and forth. These subtle changes in memory, balance, and coordination can be early warning signs of a stroke. If you or someone you know experiences any sudden neurological changes, especially if they're accompanied by other stroke symptoms, don't hesitate to seek immediate medical attention. Time is of the essence when it comes to strokes, and early intervention can make a world of difference in recovery. Our bodies are capable of incredible feats of coordination, from the intricate movements of a dancer to the precision of a surgeon. But when the brain's communication with our muscles is disrupted, even simple tasks like walking or buttoning a shirt can become frustratingly difficult. This loss of coordination, especially when it comes on suddenly, can be a sign that something is seriously wrong, potentially a stroke. Imagine this. You're reaching for a glass of water and your hand misses the mark, knocking it over. Or you're walking and your legs feel clumsy and uncoordinated, causing you to stumble. If you or someone you know experiences a sudden onset of coordination problems, especially if it's accompanied by other stroke symptoms, it's crucial to seek immediate medical attention. Don't try to brush it off as clumsiness or fatigue. Your quick thinking could mean the difference between a full recovery and long-term disability. Protecting your brain stroke prevention tips. By making healthy lifestyle choices and managing underlying health conditions, you can significantly reduce your risk of experiencing this life-altering event. Control your blood pressure. If you have diabetes, control your blood glucose levels. Maintain your ideal weight. Exercise regularly. Eat fresh and healthy foods. Avoid processed foods.